So the next part of the program is another liberating structure, and it's called the Users Experience Fishbowl. And so we have with us a constellation of people who have had experience with the Buurtzorg model, went to Amsterdam in January, and we are just going to eavesdrop on their conversation, and they're going to share with you a little bit about their experiences they had and observations and takeaway messages that they brought home with them. And then we will have a little bit of time for you to ask them questions, and then we will launch into our next 1, 2, 4, where we'll call the wisdom. What is it that you're going to take away from this morning's conversation and wisdom dialogue? So I'll let you start, Michele.
Should we introduce ourselves?
Introduce yourself.
Okay. Hello, everyone. I'm Michele Kimball. I'm the director of AARP here in Minnesota. It's the state's largest consumer organization. And we have been working for a number of years on long-term care redesign with some key partners, including folks from the University of Minnesota here in the state. And one of the things that we have wanted to look at is how do we improve quality while reducing costs in our home healthcare system. And so the Buurtzorg model was introduced to me a few years ago. And I was very intrigued, as all of you are, after this morning's discussion. And so I had the opportunity to go to Amsterdam and the Netherlands. And I think my experience was a little bit different than my colleagues here, because I did not do as many site visits as I did meeting with policy people and patient advocates. And so I bring a little bit different perspective, but happy to be here.
Hi, I'm Katherine Monsen. I work at the University of Minnesota School of Nursing. And I met Jos de Blok in 2009 when he arrived with 9 nurses from the Netherlands. And been fascinated and enchanted ever since with this model. So I really enjoyed going to the Netherlands in January with my colleagues.
Hello, I'm Michels, and I'm an RN currently working in home care. And actually, Karen introduced me to the Buurtzorg model and invited me to a discussion at the U of M only 2 months ago. And when I started hearing about it, I was very struck by the similarities in thinking and philosophy that I had learned when I was working at Bluestone Physician Services, a physicians group doing a similar model. And I had the wonderful opportunity to go on this trip and see firsthand this work in progress, and it was refreshing to see this and brought me back to being in nursing school when we're ready to go out and conquer the world, and all those ideals that we're taught, it can actually happen. So.
I'm Karina Limburg. I'm also a registered nurse. I work in home care with the elderly, and I'm also a doctorate of nursing practice student here at the university. And I was introduced to this by this model by Colette here, and just fascinated by how much sense it made to me as a nurse, and how this model allows nurses to really work holistically as we are taught. So the trip to the Netherlands was just very inspiring and very eye-opening, and yeah, I hope to share some stories with you.
I'm Colette Schenk. I recently graduated from the Master of Nursing program here at the U, and now I'm a nurse. I was first introduced to this actually by Jos when they came and visited with our class last October, and I was so excited about it. I contacted him and asked, can we start a team? And he basically said, get some nurses together and come on over and visit. So I did. I got these gals, wonderful people together, and we've had an awesome time learning about how it works over there. So, yeah.
So I was just talking about how my experience was a little bit different from all of yours, because you spent most of the week in the field, and I spent most of the week talking to other nurses and talking to folks at The Hague and to a patient advocacy group and going to a healthcare conference. So I would really be curious. I mean, I did have the opportunity to visit with a couple, and they were so interesting because before Buurtzorg, they were really struggling, and he had, not being a nurse, a tracheotomy, stoma. Is that right?
Two different things.
Two different things, okay. I apologize.
But he had both.
He had both. He had both, exactly. And I think he thought I must have been a nurse because what he was showing me was more than I had hoped to see. But what I was so thrilled about was the relationship that they had with their nurse. And this nurse really seemed as though she really cared for the couple, but more than that, how much they had learned from her and how independent they were becoming and able to go on vacation because of what she had taught them. And the experience of that nurse not just coming in and taking care of them, but coming in, taking care of him, taking care of the wife as well as the caregiver and really being a support to her, but also just taking the time to really get to know this couple and sitting down and having coffee with them. And so I know the three of you actually went into many homes and actually helped do some nursing care. So I'd love to hear some of those stories, what your experience was.
I can speak of one story here. I'll try to set up the scenario. We had an elderly man who we were going to see one morning. We were with a fabulous nurse. And we went into their senior apartment. And this elderly man had a history of dementia and stroke. He was completely aphasic and bedbound as well. And his wife lived with him as well. So this man, the nurse came in that morning and helped him get washed up, also put on a condom catheter for him, which many nurses don't use in the home care. It's more invasive. So I thought that was very unique. But they were able to, the nurse not only provided the care, but also encouraged him to participate. And he was able to. If you handed a washcloth in his hand, he was able to wash his face. And the nurse knew when to step in and help and not provide the service, but knew how to support him along that. They got him dressed just wonderfully. He was a businessman, so they put nice slacks on, a sweater. He looked great. And they were able to use just simple devices to get him up out of bed. And the wife was also able to use as well for transfers. And while she was kind of getting everything ready, she handed him his razor. He was able to, shave himself. And you could tell that this patient he was doing what he had done every morning of his life, but just continuing with that despite his disabilities. And it was just beautiful to see, because this man, when I first saw him, I thought, no doubt, any question, he would be in a nursing home here, total care. But he was able to live independently with just a 30-minute visit by this nurse that morning. They were able to get him up, get him dressed. The wife was able to have his pills ready, but it was also taking care of the wife. So we sat down and had coffee with the wife. She was able to, tell the nurse how he's doing, and also give that social aspect of the nurse and that continuity of care. And it was really amazing to see that this man could still live at home. And she also had the comfort of, if there was an issue, she knew she could call that nurse and they would be there without any question.
I'm actually kind of curious. How does that nurse work within the team? Do the other nurses of her team support this couple as well? If, for example, that particular nurse is out sick or not available for some reason or on vacation? I mean, how does that work? Was there a team?
I kind of had that experience. One of the ladies we were going to go visit, the nurse I went with, it wasn't his usual patient. Okay. 101-year-old lady who just needed help with a shower. And it wasn't his usual patient, but the way that he interacted with her, it wasn't like it was too uncomfortable or anything. It was, okay, let's figure out how to get this done. And, so they kind of share patients if they need to, but I think they try to stick with the same ones.
Well, and I think an important part of that is the Buurtzorg IT system, where they're able to just have all the patient information at their fingertips, and have that communication as well.
The computers, right?
And also they have weekly meetings. Is this working? They try to have lunch every day together if they can, and then they have weekly meetings. And so this is the amazing thing about this team model, is that everybody knows what's going on with each other's patients. You can bring a concern to your team and get the advice of 6, 7, up to 10 other nurses to support and collaborate with on problem solving. And then just to touch on a little bit more with what Karina was saying about the patient we were on this visit together. That was where the light bulb kind of went on for me, that having a highly educated, trained nurse in the home care delivering the care is where I could see that nurse finding that fine line between providing care and intervention and knowing when to step back and allowing that independence and growth and empowering that person to grow and maintain their strength and continue to grow, which then prolongs the amount of time that they're able to stay in their home.
I think one of the things that was really impressive to me as I continue to meet with some of these teams was how autonomous they felt and how like a team they felt to me. They all seemed to be happy with what they were doing, and they seemed really supportive of each other. And I know, Karen, you visited with a lot of teams too. Was that the sense that you had? And I know you've been there quite a few times,
I've been there
right?
numerous times, and it's always such an honor to go accompany a Buurtzorg nurse on a visit. Yes, what I can share maybe my first visit, how that went, and then I'll share a little bit about my reflections on that. I was dropped off with my bicycle at a door, and I went in, and I thought I was in the headquarters of the organization. But when I saw the cigarettes on the table, I thought maybe that wasn't the case. And I heard voices in the next room, so I went in, and there was a man in a bed and a nurse at the bedside. And the man had MS, he was an artist, and all the walls in this apartment were covered with huge, gorgeous paintings in Japanese style. They were just incredible. So he had MS now and was pretty much paralyzed, but he's still able to live on his own in his home with the help of the Buurtzorg nurses. So here's a nurse on the other side of the bed, and she's hooking up a Hoyer lift. And so I'm on this side of the bed, and I see that the Hoyer lift needs to be hooked up, so I start hooking up the Hoyer lift, and I had at that moment a revelation that I am a nurse, and I know what to do. And so I helped her, and he got ready for the day, and then she took him into the bathroom, and I believe she was giving him an enema, but I heard her singing. And
Glad I wasn't there for that.
I heard her singing in the bathroom, and I thought, what a good feeling to be in while we're together in this care process, to be, just enjoying our time together. And they came out, and he looks at me and he says, "She won't marry me." And then she says, "You never asked me." And then she put him in front of the table. She gave him his medications. She prepared a sandwich. She set it in front of him. She set before him 4 cigarettes in little clothespins so that he could pick them up and smoke. And then we left for the day, and someone else would come back in the afternoon and help him later on. But he was able to maintain his independent living at that level with that minimal help. I suppose we were there about a half an hour. And one highly skilled nurse doing all the assessments and all the care at one time. It was a very cost-effective solution. And I happen to know because this person was showcased in a Buurtzorg report that he had, prior to having Buurtzorg nurses, he'd had like 30 caregivers a month in his home. And of course, with Buurtzorg, the model is 3 to 4 caregivers is max. So building on the primary care concept. So over and over and over again, I've had these amazing encounters. And 2 things strike me. what is nursing like without hierarchy? How can we work together as nurses, knowing one another, caring for patients in the way that we are trained to do, and working together for the good of the patient? How do you know what the patient needs? You ask the patient. How do you know what the nurses need? You ask the nurses. You talk to each other. What a novel idea. And to see that, my second takeaway is to see that over and over and over again in every team, that it's happening the same way, and that it's coming from the heart in the same way in every place. The value-driven organization has integrity throughout. It's just stunning. So those are my takeaways from, and of course, having visited several times and having had visitors here, I know people now, so that when I go there, it's just embracing those friendships. And I will say, in case I don't speak up again, friend us. We're on Friends of Buurtzorg. And so there's a way to stay connected on Facebook for now until we get something more formal. Friends of Buurtzorg, Facebook.
Yes. Good. Thank you, Karen.
Well, I think one of the things for me that was really eye-opening was I had the opportunity to meet with a patient organization, meet with officials at The Hague, at the health ministry, go to a healthcare conference, and meet with folks that aren't nurses, that are seeing the system and seeing how Buurtzorg is operating from the outside in, and everyone was just so complimentary, and it was just very, very impressive to see the viewpoint was so consistently positive about what was happening. And it really does seem like there's such a revolution occurring, which is outstanding. My question to all of you is, everything during that week that I saw, and just sort of being a policy nerd, I tend to look at things with a critical eye, and everything just continued to be positive, one thing after another. And one of the questions I know that was asked of one of the nursing teams, or maybe it was several, was, if you could change anything, what would you change? And the answer is, well, if we could change anything, we just change it. And that's so impressive. But did you see anything that you questioned, or that you thought, there's just no way we can do that here, or that you thought maybe could be done better?
I think for me, the one thing I wanted to learn more about was, how do these teams function and be effective? Because we've all sat through meetings that are too long and non-productive. And so towards the end of our visit, we did learn about the solution-oriented philosophy that the teams follow, and then the role of the coaches that will support the teams if they ask for that support from a coach to help them problem solve when and if they run into problems that they can't solve as a team. So that was something that really intrigued me, that I was like, how do you guys do this so well and so easy? And because there's personalities involved, but I think that also these nurses are there with the same principles, and that
There's 10 solutions to every problem.
right. Yes, exactly.
They really were. The one day I was there, they were short by 2 nurses, and so they had to kind of scramble to get everything done, but they did it, and it was so seamless to me. It was just like, wow, they're taking care of it, even though they were short by a couple people.
Didn't you even do a visit for them?
Yeah. They sent us out. Can you go take care of that wrapping? We got to go take it. Yeah, sure, no problem. So, so yeah, we got to take care of one all by ourselves. So yeah, and it was very, very cool the way that they just took care of it. Yeah.
How about you, Karina? Did you?
I can't.
What was the thing that struck you the most?
I think the one thing that it was a light bulb for me, and I think for Michele as well too, is we just, I was so fascinated by the trust instilled to the nurses, that there was no question about charting. Nothing went through their mind saying, could I get sued in court for this? Would this be an issue? Is someone going to look back at this? There was just this mutual trust to the nurses, that nurses are educated. They know what to do. They know the best for their patient. And that just blew me away, because, yeah.
Yeah, the trust level was amazing. It really was.
One of our nurses at one point, we were saying there's so much hierarchy, and we chart just to cover ourselves and make sure we're, if it's not written down, it wasn't done. And at one point, the nurses said, "Don't they trust you?" I said, "I guess not, actually. That's, that's a core issue." It was Margia who said that.
Yeah.
Well, and I almost
Trusted to the point where the patient's chart is kept at their home. That's how much trust they have. Is the chart's right there in the patient's home. They can look at it whenever they want. All they do is mark down quick what they did at the home and leave it there and go. And that was just another form of trust, I think.
I think that would break a few HIPAA laws here.
I think
The privacy laws, shorthand, sorry. But I mean, just being able to do that is what's great. And I think we trip ourselves up here in the United States. We're so regulated that it almost strangles innovation and opportunity. And I think if this model can work anywhere in this country, it's right here in Minnesota, because we really are sort of that hotbed of innovation for the country. So many important and actually system-altering things have come right out of the Minnesota healthcare system, and we are always held up nationally as the highest in quality and a bed of innovation. And so I think the timing is perfect, and the opportunity is right. And we have so many things that are now coming together to help create a Buurtzorg model right here in Minnesota. And believe it or not, I think one of those things actually is the ACA, the healthcare law, or Obamacare as it's commonly known. Because there's such things as accountable care organizations, where instead of paying for each service that is performed, our current crazy fee-for-service system, they're actually paying for outcomes, and they're paying for quality outcomes. And that is exactly, I think, what I saw, what you get from Buurtzorg from this model is the quality outcomes. And I think that fits very well with the potential of an ACO and with the potential of a medical home or a health home that are just now being implemented in Minnesota. I think one of the things that we miss in our healthcare system is integration of care. We have acute care over here, and we have long-term care over here, and we have mental health care over here. And one of the things that the medical home model hopes to achieve is to integrate these three areas. And I know that our current Commissioner of Human Services is very, very supportive of integrating these three areas of care. And I think they also can be achieved through accountable care organizations. But I also see that happening in the Buurtzorg model. And why we're not doing it here already blows my mind. So I think there's a real opportunity. And if we measure that and we can show, just like they did in the Netherlands, that it improves quality of care, improves the quality of the nurse experience, and saves dollars in our ever-growingly, well, that's not the right term, ever-growing expensive healthcare system. I mean, you can change the culture. And I think the culture is ripe for change, definitely.